France's health minister has warned that the number of COVID-19 patients in intensive care could reach levels seen during the first wave of the crisis a year ago. The country's hospitals have already surpassed the number of virus ICU patients in the second surge in November. Now, saturation levels could approach more than 7,000 virus patients.
There are always 2 or 3 weeks between the peak of contaminations and the peak of hospitalizations. The person will develop a serious form of COVID will develop it after 10 or 15 days. If we reach the contaminations peak this week, that means that in 2-3 weeks from now, we will have the peak of patients in intensive care units.
Spain, like France, is relying on vaccines as the way out of the crisis. A further 1.2 million doses of the Pfizer COVID-19 jab were delivered on Monday as its regions prepared to expand vaccinations to more stadiums, auditoriums and even bull rings. Across Spain, from Catalonia to Pamplona, health workers are preparing to inoculate more people as the country's vaccine drive pushes forwards.
We're getting ready to vaccinate 10,000 people a day. We can do this. We can do this with the incredible dedication of healthcare professionals, coordination and the cooperation of citizens who arrive on time.
Meanwhile, health officials in Venice have started using a vaporetto or water bus as a mobile COVID-19 vaccine clinic. It's to reach residents over the age of 80 who live on some of the city's least populated islands. And in Serbia, hundreds of thousands of doses of the Chinese Sinopharm vaccine have been delivered. Serbia has vaccinated some 1.5 million people. The government's eased restrictions despite high numbers of infections, saying it's to keep the economy going. Evelyn Laverick, Euronews.
Well, as we've heard, French hospitals are buckling under rising infections, but the authorities are now hoping to boost the country's vaccination campaign by opening a new super hub at the Stade de France in the outskirts of Paris. And our reporter David Chazan joins us now there from the Stade de France. David, France, of course, much criticised initially for the sluggish rollout of the vaccine campaign. Is this a sign now that France could become a symbol this could be a symbol of an accelerated campaign using the national stadium like this?
Well, Alistair, that's certainly what the government and the health authorities are hoping. You can see a little bit of the queue behind me. There are several hundred people waiting here, and the stadium doors the gates have just opened in the past few minutes, and people have started going through to get their jabs. But this is a powerful symbol, not just because it's France's national sports stadium and football matches and other fixtures will continue to be played, by the way, during the vaccination campaign, but also because this is in the Paris suburb of Saint-Denis, which is one of the worst affected parts of the country. Infection rates here are much higher than almost everywhere else in France, and local hospitals are struggling to cope. Doctors saying that if infection rates continue as they are in the next few weeks, they're going to have to start selecting which patients they can treat and which they can't, which is really a dire situation. Now, from the queue behind me, you can see there are a lot of people here wanting to be vaccinated. But one problem that other vaccination centres have been experiencing across France in the past few days is that a lot of people are still reluctant to have the AstraZeneca jab. Now, there is a lot of vaccine scepticism in France, partly the legacy of past drug scandals, and also, of course, partly because of the suspension last month of the AstraZeneca jab over fears of possible blood clotting. And doctors are now urging the government to launch a big mass information campaign to explain to people that the benefits of getting the AstraZeneca jab far outweigh any potential risks. Nevertheless, officials here at the Stade de France say a lot of people prefer the Pfizer vaccine, and they're saying that some have even refused to take the Moderna vaccine, apparently because they've confused it with AstraZeneca. but nevertheless, health officials here are hopeful that this will mark a new stage in France's vaccination campaign.